Mr. Thangjam Giriba, AMJWU President, Sri Bijoy, Sri Manas Majumdar, Facility Director, American Oncology Institute, then the resource persons, Dr. Dhanabir and Dr. Neha, for the media, especially AMJWU members, especially lady members, American Oncology and so Babina Diagnostic support staff Neha. Punamapu, Koranjari, and Nasigi function see personally in a high Amna Maru Baduma program and Logi. Madam the cancer see no Nomagi Mag incidences from Hangalapunum Togi, not only in Manipur but globally. Study Amagi Matung in Na. India the su cancer incidence look at Aduga Uziki and globally the breast cancer in a top ne. Chama Manunda cancer incidence hot matanda chamada 12.7 the breast cancer topped. Anis over the lung cancer on 12.2%. Chama Manunda 12.2 sina lung cancer. And the top the breast cancer quite a common noiba, do mammary cancer. I don't know. Quite a common noiba, cancer say the quite a importance people of time. Manipur su accepts nothing. Manipur su Han Koyalang Kaugi cancer and cervical cancer and Lermadu, Hausiti, breast cancer na take over Toraga, number one the breast cancer Manipur the Sudum thing. Adubu cancer incidence in North East and Yankanda. Manipur Yamka Hanawamadi or Triaduna, quite a Katan, Nungayam the Pawi. Notice the Mizoram is number one in cancer quite in 1 lakh population, 274 cancers are coming, males. The Anish of the females and Arunachal Pradesh in quite a one. Nearly 170 cancer among 1 lakh population, Arunachal Pradesh. So, notice the picture. The India on average the young taradi males the 1 lakh population the 94 male the theory. Aduga female the namu currently have 103 per 1 lakh population among the females. Manipur ki wani yamuraga the mo high baga sagi 94 and 103 male and female say Manipur the karam male. Male the around 74 per 1 lakh population aduga female the na 103 mind. Sina takpadi nupi na nipadagi cancer na beheli. Adagi India ki wena su study mai matungina. Me kuntra kudingi say out of 31% in their lifetime, in his lifetime or her lifetime, cancer will develop. Akoi ngasi whole the koi humpumuk lay. Humpusli the koi light the me ani this way the monkey cancer nagani have the sig studies in heights. Sina namagi the makta Laina Amadi Lakta heart disease no ABI, kidney fail even no ABI, liver narc no ABI, and the Matunda cancer na Amo Vitune. The cancer seems in Manunda, Quina Tangabia, see incidency and work at the pardon lung cancer, the Pidan of Pidi to anything about cancer, breast cancer. Adukimatic Satiba menaced over the way Nabunaradi, Signi, and Okoyamki cancer. Although it's not always true. Cancer is preventable, curable. Preventable by lifestyle, food habits, my prevent to some extent. Aduga curable soy. Curable sikam kan way early detection. Ngan na kang masina early stage the kang many of the cancers are curable. Sigi message may presenting aduna daina do man da koi awareness khangbam sangam. Awareness layer definitely koi conscious awareness na dum tangda. Aduna yam na early detection to buda koi early detection to ragadi curable work any habits. Aduna ngasimak ngasi is awareness program ni. Globally, it really pumadani breast cancer awareness in the month of October. October month is known as Breast Cancer Awareness Month throughout the world. aduna ngasi so koi Manipur da so sigisi celebrate to bhai dekho sigisi observation to bhai we never celebrate about disease, we don't celebrate disease, we observe just to make consciousness among ourselves about the disease.
Expressing they can consider Lunana. Sigasumba, Omi, the Bison, the Uiba, breast cancer awareness program, consider the regular fellow collecting, exchanging, seizing, all passing, no more to progress of river, fencing, no good type of setting. The same with the Mississippi said that Lena see Tunga Lena Kia, no, Lena Kia, like him, Luna. Cancer, I see Padiki Kinaraba, Messi, Hagunum, the Hina Kanaba, now in Germany. Haiba, Anaba, Sigi, early detection to Nanaba, Amadi, the Sigi awareness, I'm a peanut of formation, the species, formation the Kaligin Haka, the Pomi is a Pomi do not eat a gun that covered the Tribunal.
It is very clear day one when I landed here and I talked to Sir, lovely Sir, that we need to serve the society, we need to serve the people and with an affordable price. And that mission is going on. I need everyone help, who the medias are present. We need to do activity all the media house and we need to scale all the people. And we need to do the presentation how cancer spread and what is the awareness and how to prevent the cancer. I will not take much more time because all are here.
Breast the epithelial cells, cyber cells makan khara yawe. Sigi cells sina control to work ngam da bamunda uncontrolled growth tawrakpadagi mase spread tawraga tumor form tawrae and causing breast cancer. The breast cancer say it is one of the most common cause of cancer. Not only they are common oibadang natana, they are also one of the leading cause of death because of cancer. Cancer, breast cancer naraga mase yam sigaligi series. Why is the fatality my series yam yami se karidino haibada breast cancer city hawrakpa matamda usually they are painless kemta nade makoidi and they don't cause any discomfort. Nungaitawa amata akoigi day to day life the discomfort amata pidrabadina we akoy khangdare mase kem lay haibase aduna koina nupi oibising na yamna proactive oina akoy self examination tawbase yamna maru oye nganna khangnabagi. Okay, another thing mayamna common oina khangbibo or khangingbase like what are the risk factors in eba kana dana hina oiba yage or kana kamai tawaga prevent tawba yage haibase. So risk factors say like firstly ahanbada akoigi body sida estrogen and progesterone haiba hormone ani yawe. Sigi hormone ani se akoigi nupigi menstrual cycle matamda thagi menstrual cycle matam sida na hena produce taweba. Duna nupi amagi punsida yamna kuina menstrual cycle se tawrabadi then it can increase the risk of breast cancer. Sigi hormone anisin na akoigi woman gi breast the egg tawrakanda it stimulates and ma growth to halle. Aduna haibadi nupi amagi punsida yamna nganna magi periods lakhiba menarche se before the age of 11 years oihiba aduga menopause thagi khamba se ma after the age of 54 years oiba. That means nupido yam kuina hari hormone anisid adum exposure leibado aduna it increases the risk factor. Then another thing is nupi yam agi first pregnancy say after the age of 36 years oihiba or pregnant oidaba nupi singda hena risk factor se wange. Then on the flip side like akoina pregnant early pregnancy oiba then after pregnancy breastfeed tawbiba se these are like risk factor amo handa halish ising sina. So breastfeeding na breastfeeding na kamana hanthahange haibada like during breastfeeding something lactational amenorrhea haina akhoi periods lakpase lebeba breastfeeding tawba matamda tha taruk rom se aduna so we are not exposed to that progesterone and estrogen. Okay, so other things apart from this risk factors say like radiations, X-rays, CT scans, if Dr. Consultant Babina first degree relatives breast cancer or ovarian cancer history then it's also a very important risk factor. 1 BRCA2 TP53 genetic mutations and inheritedly they increases the risk factor. Testing so okay, so examination say the right technique to make the most of it. The videos self-examination to before that kitang high खुद से थागत पीरगा अखोइना येंगदबने breast की symmetry चप मानदब्रा any new changes in the color texture change laibra nipple any changes laibra khotbra adagi skin da any kutsan but dense kumba laibra haibase shina jingba singse yengadabane aduga lepaga mirror gi mamang da yengba loiraba matung da akoina mu hiptharaga ko akoigi khutna middle akoigi finger ahum se lawraga small circle da akoigi keno upper breast dagi axilla dagi armpit dagi tawraga tapna loina yengadabane breast cancer gi lamse kamai toge haibada mase yamna hard oye ko mase kalwe aduga lengba yade thengnaba matamda lengba yade aduga magi surrounding magi borders se yam irregular oye aduna akhoina sigumba anything yengba matamda thengnaradi athuba matamda doctor tana bigadabane ko nana self examination dangna su keno yadi just because I self examine the way aduga like kemta thengnade doesn't mean that haidi loina phare habasu natteba na khoina there are certain breast cancer makhan laye event lump form tawdaba mass form tawdaba like inflammatory breast cancer gyneko na sigumba singsideli then here comes akoina modern technology tools maya mammography ultrasound MRI se use tawgadabane so mammography se akoina 40 years to 50 years se akoina yearly mammography advice tawe then 50 to 70 years na every 2 years advice tawe and after that according to the life expectancy of the person every 10 years kumba advice tawe then again mammography dangna so muk yade high risk factors singi patient dadi like breast cancer makhan laye mammography na mu phaba ngamdaba ko calcification thokdaba like lobular breast cancer gynecolobular sumba LCIS ka haiba breast cancer laye makhoi dadi calcification thokte akoina mammography na uba ngamde then here comes akoi ultrasound and MRI tawba change so high risk oiba family history laiba and high hiba hanbagi risk factors laiba singdadi akoina like mammography tawraba matungda after 6 months either ultrasound or MRI tawgadamne then that way like every 6 months we get a screening done she can be important or haibada yamna certain yamna aggressive or breast cancers makhan laye like in between the mammogram like makhoi breast cancer next mammogram cycle the lakpada even like on breast cancer hawramba bhaw yawe aduna we should understand the risk factors but kenalo shalakpada ina haizening body akhoi nupi oibising every like calendar akhoi periods loibagi 7 days hek matungda alarm or calendar da akhoi na khamsana breast self examination se tawthokadabaneba ko video dong tang yengminase
Dr. Dhanabir Thangjam, Surgical Oncology AOI, to give a presentation.
I am Dr. Dhanabir Thangjam, working as a consultant in surgical oncology at AOI Imphal. So this is a greeting from my institute. I want to start this program with an quoting: awareness without action is worthless. Koi khang badi am khang adu koi thabak wen pang thok pasi kya tawte andaki thaje koi awareness ka dum chachai mafum khara dasu, but in actively participate tor project machine khara haina wat pan when over haitare ko dana. So I want that everyone should come with some action and take the advantage of this program also. So as we know, the October month every year is a pink month or the breast cancer awareness month. So let me start why this breast cancer awareness month has been observed and what is the scenario in worldwide. As I highlight, breast cancer is the most common cancer among the women. Globally, every year around 2.3 million cases have around 25% of all the cancer is the breast cancer, and it's the most common cancer among women, and it's the most common cause of death related to cancer in a woman. So these two lines which I have highlighted with red is important. From 2008 to 12, there's an observation that increase in incidence. Now by around 20% hangale and mortality by 14%. So and we expect in the next 2 decades, there will be around 60 new cases and 70% of mortality, especially in the developing country like India. India low income countries my cases hangalakoni loina my si bagi sang si hangalakoni estimate si study me am delaye. So this low income country rapidly rising incidence and high mortality is a alarming statement. So let's look this graph. The pink, as I told, that the breast cancer is occupying the almost 25% of all the cancer in the world. So this is a world map of breast cancer. You can see the entire world is filled with the pink color. That means cancer is spread all over the world. And there are a few areas where are gray and orange, or they have no or very less incidence of breast cancer because it is lessly populated, or the people's states are not so prone to develop breast cancer. And see, this is the mortality figure. I want to go back again to the previous slide. If you see this North America, Australia, they are full of breast cancer, but their mortality is very less. But whereas in our Southeast Asia, the mortality is still high because the screening awareness actively participate out there. The breast cancer naraga mortality have the breast cancer sibagi samse yam helini nabasu yam nai sibasu yam si. So this is not a good thing. So again, this is from the ICMR chart. See, Australia, the number of breast cancer is 95%. Now, but mortality is very less, only to 12%. But come to Southeast Asia, India, 40% muktane na IC, but CBD 15%. So the proportion is so high that is more. So let's come to Manipur. This is from the Indian Council of Medical Research. Masiki body sinna koi cancer ki statistics lema kholo ka thammi. So this 2005 breast cancer in the gray color was not so high. Initially, the lungs cancer and cervical cancer. Angang hau machingi amasung lungs cancer na Manipur da 2005 to the 1 and 2 lerami, breast cancer na 3rd lerami. But the graph has changed. 2014 si matung tadi almost now 15, 16, 20 20 of the breast cancer na number 1 oil. So duga cervical cancer na 100 ko. This they have a reason behind this because cervical cancer ko preventable po rakpa mayam khang pa ado breast cancer si khang makra wali or state Manipur. Now we can see, as I told, breast cancer is the leading cancer in Manipur. 15% followed by lungs cancer and cervical cancer in the women group. Same thing. So the leading site of cancer in Manipur among the female is breast cancer. So why we observe and how this breast cancer awareness started. This is the First Lady of America, the wife of President Gerald Ford. She was a breast cancer patient. She underwent surgery and she recovered and survived. But when during her visit, mana naring manungga, mai hospital sa matamda, unpi may amam naralen, layang mangamdaba, am wana changramba, mayam changraki. Then he asked the president, why don't we start some program to help these people or all women? Adugi matamdagi hauki. It was started as a National Breast Cancer Awareness Month in 1985 whole, in association with American Cancer Society and one pharma company. The motto was to promote screening by mammography and fight the breast cancer. So after that, this has become a global program. I might have the world club sandoki have a small history money. So what are the objective when a breast cancer awareness month hairaga karino when to say mayam among the thamjani to raise the awareness among the breast cancer mayam the khangan ba, not only the phami mayam sina tabo masagi tari mayam sina mu masagi ngasi program si yaw daba friends sing relatives sing dasu ay nang tang thamjari point sing si spread to biko mai na pong jo hon biko khangan biko itu get to biko hai. Then second thing is to promote early detection. Masai koi mayam hai early detection is a way of cure and support the affected people. Na mayam support of vivo. Moje throughout the year when support of vivo. And also raise fund to research of breast cancer and fund to preventive actions and treatment also. So that's why 2023 the theme is track 365 days. I would say 1 month the whole year should be observed on the highway motto the 2023 breast cancer awareness month. My previous speaker has already said about the importance of breast self-examination. So these are few things that how we can do when a breast cancer awareness month. Say observe the way I have the breast self-examination. She has already described very well. Then clinical examination. Clinical examination hagana doctors na yang biba. Masagi doctor mana magi breast examine toraga yang basu clinical examination going. Then mammograms. Ando bang sign hajikiba participate, donate to like some fundraiser and wear pink. So that's why I see everyone wearing the pink ribbon today and share information. Like mayam sinang sagi friends and colleagues ta amasung relatives ng dasu tabadang natana mo dasu information TV ko educate topic ko have system. Why this is important? So this is the hashtag breast cancer. Out of 8 women, there can be 1 woman will suffer from breast cancer in their lifetime. Nupi nipan pambada nupi amade breast cancer na can have a say is a hashtag line, and every 50 seconds in the world a woman dies from breast cancer. How's breast cancer because it is the most commonly diagnosed. But one important thing that I want to highlight that 23% of the breast cancer can be prevented. And as I told you before, low and middle income country naabagi chang ga sibagi chang is disproportionate way na su yam nai si su yam si masigi maram si akoi awareness wat pagini awareness khangai ga sumu action tawdo. But in low high income country there is a reduction of breast cancer death 40% hena moi din na su mortality je hanthare sidre. That means moi cure over sem ngamme. So what is breast cancer? Breast, see, male is lay, nuparusu lay, nupirusu lay, but the breast tissue is more in female. So when I say breast cell, I'm a mutate over soiba due to some risk factor, some stimulus, some of the soiba, must mutate over, must have the masak home, must grow over uncontrollable. It keeps on growing and forms a tumor. But nupabadi sa breast se shoes yam yaw na masi na bai sang siam hanthai almost only 0.5 to 1% mutang lai koi Manipur sa mane nupabadu na ba theng na kre ai among the patient ama karkui long back when I was in Jennings. This was my first patient of breast cancer in the male was operated. Symptoms. This is the starting of breast cancer awareness actually. So kay no high risk kangmusi. This is the World Health Organization people chart me. This is the warning sign or early sign of breast cancer. Number 1, koi nipple changes, nipple masak hongba invert out. Nupi nipple should be pointed, but if there is inversion, kusalappa changthen gi balai gadi nipple changes and any bloody discharge. Koi nipple discharge si machu si bloody orap. Nupi blood nipple discharge that is not a warning sign. And the lump in the breast is the most common breast symptom which we observe or we encounter in every OPDs. Yam common way. I'll come to this. Changes in the breast skin color. Breast ki skin ji machu hong pa habiti kamai na hong no. Skin color is not komla machu don hong pa pitting of the skin komla khoktoga khutna mesama mod khutlaga leba adamai to lagadi. That is a warning sign of breast cancer. Aduga even pain sa hagre lump like tagu adum na lagadi not related to the menstrual cycle tha khungkap lakpaga mari laina tabida adum na leba constant pain lagadi. That is one thing to be checked out. So most breast lumps are not cancer. When I am thinking, I am so the breast lump am layer has cancer or but not there. There are many things that these are not breast cancer. Not the am so like but when a minor needle biopsy, the test of an account, do my am looking test of the nagadra. They are afraid of getting tested, they are afraid of getting screened. So this one slide I want to share it to everyone. Nupi ko dimag nakhanga the fibroid adenoma haibam lai breast is cyst haibam lai mana cancer. Si hom si mimic tawi du thena badiam lai. Si usually happens in the young adulthood. Nawikan the nai mo si. Si nakitang ko 30-40 fibrocystic breast disease na. See and see, these are not cancer actually. Makoy usually single oil, multiple oil. Masai Dr. Neha so haji gibo. Moy structure is pai matam the wrong organ. Amaduna breast cancer gana kita irregular organ pai with the wrong taro. Aduga moy soft oil pai with the kan oil. Then moy mobile oil. Breast matak kalem, but the makhala chain ba sometimes mouse in the breast kind of high name of physical. So I am see, I'm kind of worried with the screen of the company when cancer or non-cancer happen. So Dr. Neha already high, but I want to divide the risk of breast cancer into two types. One is non-modifiable and another is modifiable. Non-modifiable have once a born nupi in a proposite mohana nupi in a so nupi na pokposi breast cancer gi risk amadum oi lere halo salakpa akoina aktopunga moi dum sahi dum namakani genetic mutation gene DNA level dei sore pasi akoina change to di arroi family history sai high early menarche early menopause madi akoina hongwa yaroi aduga 7 point si yam toina hange engonda minasu dense breast as kaino hena dense breast is not about the size the native cup size native sagi breast si fat amasung glandular tissue na khaito dense breast layer gadi breast cancer risk wang khale maram di fat masing yam do my gland masing yam is because there is a constant changes by estrogen and progesterone level chum queen level degi dense breast where kani or some genetic problem level degi hormonal problem level degi aduna dense breast how can we screen dense breast is by doing a mammogram to kan apa category pilakani doctor na adu matungin na dense breast level so it's becoming one of a thing that akoina mammogram na akoina calcification level or apoma level to kitang yang to kona taba dense breast level gadi akoina we have to do some other modality kamaina to godam habati dense breast koi chahi nauriba 30s 40s ki makhada level no pidari breast usually dense oil adu chahi as the year advances the density should decrease handar kadam level but how do we know koi kamaina kan do kadagena asai when at 40 the mammography mo taweng khalase adugi next year the density se hantaraba then is a good sign hantar also hengalaba then is a bad sign so increasing in the breast density is a high risk factor then modifiable risk factor see asai su aina hajini 23% of the breast cancer can be prevented by modifying this risk factor. Number 1 obesity, smoking, alcohol, hormone replacement therapy and other lifestyle and obviously food habit also. So almost the same graph. These are non-modifiable and the rest are modifiable. Among my previous speaker on high grade, breastfeeding is a protective name. Breastfeeding to mamana sagi masa khomlang pitak pasi 1 year pitagadi breast cancer degi risk se handan mangam heba ko aduga nganna yum panba nganna angang pokpa so mayam su breast cancer degi risk hanthale aduga regarding the prevention I divide the prevention into 2 types. One is the primary prevention and secondary prevention. Primary prevention, that is lifestyle changes is an prevent over. Then we have chemo prevention and prophylactic surgery. These are for the genetically mutated or patient that talk about. These are for those high risk patients or which are BRCA positive patients. Chemo prevention, prophylactic surgery. Secondary prevention, higher than screening and early detection is a secondary prevention. So I think we may have this famous Hollywood star Angelina. She was diagnosed. She was having this BRCA gene tested, and she found that her BRCA gene was mutated, have the positive high rate. Then she underwent prophylactic mastectomy, have the breast and also the ovaries, palliative oophorectomy. See, this effect has been globally widespread. The Angelina Jolie effect. Now this effect has come even to India. Recently in Kolkata, a patient called Mosmi Roy also tested BRCA testing because she has a strong family history. Then she consulted doctors and the same surgeries, the same procedure was done, and now she is labeled as a breast cancer free woman. How do we do BRCA testing? BRCA testing is a test, that's blood test. It can be done in our center also, but it should be through a genetic counseling. Counseling karma mina BRCA testing tawni habse akoina guidelines lay adu matung ina follow toroka doktor yai. And it's not very costly also. It's around 15 to 20,000. Breast cancer screening. Screening hai kana koi symptom mai taba kemta na da mi da koi na test tawu screening kawi. Diagnostic hai kana koi na me amna test tawu adu ngasi koi tawu screening hai si me am se lai si kemta koi na breast cancer na hai gi natte na ba lai bra hai na yang thok se na chinba program. Breast screening ida koi na high grade self-examination, clinical examination, mammography, and MRI in selected cases. Because we hide, we isana losan jay, hidokte, kasi tawde na dum tamjan jaba, sinasu tang koi da bias samalaya. And clinical breast examination to be trained done by a physician or a trained health workers, and mammography of after 40 years. So, types of breast cancer screening, population-based screening, universal screening as a national policy, but it's not possible in low-income countries. We income countries that masigi tang national policy sin masu wabalay. Opportunistic screening hai gana masi ko doctor da chalu matam da magi like for antenatal checkup to matam da check to hoba magi kino malak matam da check to hoba si antenatal ko opportunistic screening na ko na hai and risk-based screening. Saya hajabat breast cancer risk. My family history le magati ki matong na ko na screening si tawasin na ko na risk-based screening hai na khangne. This is for high to moderate women or breast cancer. So same thing, breast self-examination and the difference of awareness. Awareness hai na we have to give the education and what are the advantage of doing screening. Awareness cognate. I will not go again, already said by Neha. The guidelines depends upon the age and upon the risk also. So this is the guidelines for general people. Mayamgi, masay high grade, say 50 matakta. Above 40 is the screen torpa. And this is for high risk. High risk they should start from 25 years. We start with from 25 years is the family history level BRCA positive or over 25 years. We should start by doing a MRI breast, not by ultrasound or mammography. Because say now we want to be the breast density yang wang na. Atau pernah pick up tolongan dia, na MRI is a diagnostic tool, screening tool for high risk women. So, clinical breast examination performed by trained health workers is a low in cost technique. We can start from annually from women above 40 years and women with 30 to 60. Which is do when every 3 years check if there is no clinical finding in the first screening, and more frequently in high risk group and Sahajagre. This is suitable actually for a setup a country like India. Mammography was started in 1950, and this has been found that around 15 to 20% of breast cancer can be detected by mammography. Thereby, it reduced the mortality from 15 to 20%. And this is the only screening tool so far validated. This is what mammography. So it is not a very invasive thing. Breast tissue, film compression breast X-ray. She's a quick procedure, but there's a challenges here. India ki population ji the breast screening si mammography na wide. and there's a high cancer burden, cancer topography, and inter-country difference. Lam amaga lam koi state manunga amaga khara khena basilai. Aduna national policy o nation mujukra wari, and unavailability of trained expert masing wat pa. One of the big factor why the breast cancer screening has been a challenge in India, and poor infrastructure to provide evidence-based treatment. So come to Manipur. The population of Manipur among the female is 17 lakhs kumalai, but we have only 4 mammography machines. One in Babina Diagnostic, another in American Oncology, one in Caesar Hospital, and another in a new diagnostic center. They have just started. So mari katang lai pa Manipur mammography machines. So how we can screen our 17 lakhs women skin to ngamoy. Aduna awareness, self-examination, musung clinical examination sina koy di best tool mo oy na koy na thamjani. So these are the conclusions in the one of the trials. So clinical breast examination conducts every 2 years by a primary health worker can diagnose breast cancer and at the early stage. So ang sahajagre 15% mortality handan mangami ko screen tawo basina aduga younger women also ko screen tawo ngami. So clinical breast examination is considered as a breast screening in the low income and middle income countries. But in early stage, more than 90% can be curable. 95% hena stage 1 amasung stage 2 di cure tawangame breast cancer. So this is the importance of breast cancer awareness month and detection. So sign high grade can prevent it by lifestyle modification and genetic testing. So this is a survival graph of breast cancer. Stage 1 in the green and stage 4 in the purple color. Aduna stage 1 is almost cure ne my survival rate am wang na lay. Aduga stage 2 di or 3 and 4 survival sam handrak ne. Aduna breast cancer ngan na khanghawi gi survival cure ngamani na survival gi chances am wang. So I have some conclusions slide. So as we all know, breast cancer burden is on a rising trend. Hengalai sai 2005 tagina 14 da maji adukimati wankalaki. The importance of breast cancer awareness and early detection. Kung sa haire khango basina knowledge level gadi at least isana sai warning sign na khanga gadi thengnara gadi koi detect tawna ba test tawsi screen taptoksi. Aduga preventive methods sina big impact lay 23% je koina prevent obu yai, and breast cancer has a high potential of cure. Sai join hajak 95% hena cure obu ngami koi mayam tawre, and we need support for the breast cancer survivors. So she is also a breast cancer patient and Australian singer, operated, and she is living free without any problem of breast cancer.
breast cancer se na na aduga ma gi factor cases se gari churuk ta koira alcohol leira there is something adum ba cases se kan manen thing bige adu hojik ma gi adum hang hang rage ba another last question na agi preventive and curable lo hai na first stage second stage already amuk ma gi left side or right side amana na re kala I must curable I need some chemotherapy and all my treatment amuk another left side or other side ma lay ka hai si bahari another 5 years ki matunda adum fazana de na tangum tan
usually breast cancer is like cancer for all women and haram jahi niphu ki mataki anabani or yankai mataki anabani na koina consider dormi maram ni sai ki thai khongkap toina toigai hormone changes lai di gai ma cancer risk wan kale but adu koi recent years da koi nupi young women hai tare 30 sai de su koina cancer thengra ko hore koi presentation khara tok jagare presentation khara tok jagare Manipur ju breast cancer in young women hai akhoi na jam toina thengne even pregnant women sai kunthra su da angang ma je pregnant oil na check to sa matam da breast cancer lai ramba koi jam toina thengne masi maram si sagi lifestyles and amne duga second thing my genetic factors koi Manipur ju prakar testing ni koi to bo hore adu yam toina di to bungam de mayam si because of sagi risk certification ni masana haidok tabni khangde khar lak ta bai ta adu koina screen to thok bai prakar testing si koina blood test amani blood se gi law ga koina mal screen to thok adu gi karigumba braka gene have ji mutate or magadi 1 and 2 have like gene si mutate or tardi adu the breast cancer risk dum wa khalani adu lifetime my breast cancer risk mayam manaro soidra narani hello moi se adu mayam si koina nahara kinari si aduga masagi lifestyle hygiene smoking is one of the bad risk factor yang fatal risk factor amani then kogi obesity then hormone replacement of angang oina bagi chaba or angang laitana bagi chaba summa si yamna pungja sasan ba koi doctor gi prescription now bana pharmacy bande leiba la chaba su koi dum toina thengne siguma su masagi young naha singda breast cancer narakpagi mana positive factor mana hygiene am important oi mayam ji once nagaragadi amhona narodra or prabhagadra haise masi koina haidani depends upon a stage ngalingai maji amwa halakoi chances am neme but akoina mokoi ji 5 years ti hodum screen door legani check door legani because halakoi chances se khadi lei stage 1 ngai have the once first stage that the halakoi chances name gani stage 2 dun halakoi chances khra wangani 3 dun amai wangani 4 dun sapain wangani aduna hai aduna 5 years se koina magi surveillance period and thami sigi manung che koina yamna fajana strictly moi hide si every 6 months in a year check lakadaba for the first 2 years then 3 years sokan annually to when check to adu risk wang ba patient mai sagi koi ju sai breast cancer je mahum koi type ma kitan nate koi lobular have su lai di high grade lai du mayam ko kana koina mai surveillance 3 months kumba to su yaw adu masagi prevention ni matang da mahaki karumba koina breast cancer ji operation taram dai or operation matam da koina hormone test kharta ER have the estrogen progesterone adagi HER2 and KIN ta koi je khanga matung da koina karum ko si hormone ji makoi da positive oiram ta ga di koina makoi je hormone ji receptor hai ta hormone receptor ji bu prevent tawna ba hidak sahal 5 years ki aduna masagi atopa opposite breast ta or same breast da mu khalak na bagi koina koi preventive strategy oina mo hidak sahi manga gum gi chan ba or tare chan ba do ri sangwang ga na chai tara bu chan su le
breast cancer se prevent to budi amating oi de haibi ko adubu masagi mama ke ama breastfeeding to da yawe ba reason budi me apa be magi breast se to maintain to da oiro figure di wor da hadi breastfeeding to da mama ke am ui uzei thing na zai sa ado oi je awareness oi de habuzu yawe educated oi budi ke am su yawe ba mai to da sa ene khangjaning mase masagi breastfeeding to da na ko masagi masi cancer na kana bagi step kumba lokho pa yabra adugumba ki khar laibra tagana breastfeeding moje risk to laina dum moje breastfeeding tawdira ha to inta khangzani
office tabaka ba because of my tabam sin bagi angang breastfeeding matam ibangam daba thamagam piramaga adum next month dagi my maternity leave lo tabaka gi breastfeeding dum tokhi bhai ta usually kashinate mon higher the breastfeeding to matam da lactational amenorrhea haina songom pitai matam da ma sai amro or thatar kumom mens lakna leidune si matam sida the breast stays normal padana yam pathara lay si pathara is important words like breast ko na thakading gi up and down hormone men's lakpagi hormones up and down sana sa breast ki density je hengalakpa nodulity hengalakpa si ne expected hai se adu mana breastfeeding tawra gadi lactation amenorrhea thokuduna prevent tawai wane breastfeed tawduna natte masai men's on dawduna adu masai breastfeeding tawdabida atopa preventive method labor hai gadi koina dum haidani ideal weight ama maintain tawiba junk food chadaba odigi fatty food chadaba sugma suju meyam important oi doga stressful life laitaba sidu dum preventive measure dum oi ni na haijani
keno pata hanjege hojik aina hamdori kadi kitang di chana da bradi khanjadre hojik akoi tasena da manipur da ai hangjadre bai samusu yum pante aduga hojik manipur da yum pan da bai chang da sukri mate wangi nupi da adu haiba koi nupi singsida makoi magi angang nubi yawi kanu silai trabanina masida akoi hojik breast cancer ki chang si masih wanggadra natraga magi kanu sikari lokhat ba yawa kan je sahar ki setting kita habina uning sinjare
nupi ni yum pan da bai basi amoram da haira gati magi personal problem na am or be adu yum pan da bagi kana da basi angang pok da bai tare pregnancy etram na sagi ko gi magi sai tamani menstrual cycle lo dum thok lai ni ko aduna sai breast ki tissue da awa ba sum pi le ni ha ba gi kino sin mai ideas ne kana yum ngana palu angang ngana po na hai se chi adu si yum pan da ba no pi da su or pan no pi da su koina hai ni ba si adamai na yum pa la roi na lai ba no pi sing da koina hai ni ba si screen da thok ai adi ai ki breast da risk lai ba lesion lai ba chigna ba ba or kona noi da ba anabo or pya ba problem lai ba na screen to thok ai adu ki screening si angtang hawra ga di kwen e risam lai or lai ke khangawra matung da risk lai da patient ni dum generally mayang marana dum salani ko risk full lai ga di adu risk tu matung na ma se koi preventive action hai tare ko lesion chingna ba lesion lai magana biopsy tawra test to thoga confirm to bi hoga adu ga lai magana koi operate to hobiyo confirm to ga operate to hoga treatment to hoga ko like to have na magi next from kan amu screen to me je koi na mu hai ba chahi khuding ira or 3 year dira smai to ye aduna yum pandre ha breast cancer narani nek ki daga koi ji mine samu phatte to kana to ga tanara screen to thobe na dana wa dare
okay ISTV news again yam simple of the question ne doctor na sai risk factor mayam ma thabi ki bagi marakta akoi gi ngasi gi akoi na manipur da hingiba lifestyle ko akoi environment da mara moiraga doctor na encounter tawba cases sinda masigi risk factor se karam bana machine khwai da gi yami ge haibada adu thamyo ida alcohol yam use tawba gi obesity gi karam bana khwai da gi hen heli ge haibada madu khanjani
thank you certification ji research ka wapana koi yam toina di sabsaba data pibdi ngamri but ai observation da obesity was one of the common factors yam toina thina yam obesity noi masa khra chawba nupida ma oi degidi masagi yum thenga panba yum pandaba aduga yum palagana angang laitaba summa nupi sing da respective oi aduga junk food che chu koina masagi risk factor ma'am ne koina thiga pam changi kan junk food chaw de no korjin ha basing ji adu ai gi observation oina khangbada number 1 obesity se yam common oi breast cancer na ban bi sing koina thingai se obesity khrading oi mai BMI se wangi mi tang nemaga masakar chawba then yum pandaba yum thiangna panba or angang laitaba sumasin am oi
hello my name is kakchingtabam working in Daily News as a reporter. So, Doctor, aina nasi kena sih kita khamzaning basa ama katang ni. Aku ki ahal mana hina badadi aku 13 years sulagadi sumaina aku periods la hina. Ado pre aku 13 years sudah dengan sulak pada 11 years ta ama yau ni. ꯑꯗꯨ ꯃꯁꯤꯗ 11 yearsꯗ ꯀꯩꯒꯨꯝꯕ ꯂꯥꯛꯄ ꯇꯥꯔꯒꯗꯤ ꯃꯁꯤ ꯀꯝꯄꯜꯁꯔꯤ ꯑꯣꯏꯕ꯭ꯔꯥꯕ ꯀꯩꯅꯣꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯁꯨꯃꯥꯏꯅ ꯀꯦꯟꯁꯔꯁꯤꯒꯤ
ꯅꯠꯇꯦ ꯂꯥꯛꯈꯤꯕ ꯍꯥꯏꯗꯤ 11 years early minority ꯍꯥꯏꯗꯤ ꯃꯈꯣꯏꯁꯦ ꯔꯤꯛꯁ ꯈꯔ ꯋꯥꯡꯉꯦ ꯍꯥꯏꯕꯅꯦ ꯑꯗꯨꯃꯥꯏꯅ ꯏꯁꯥꯅ ꯑꯩꯁꯦ ꯈꯪꯉꯒ ꯏꯁꯥꯒꯤ ꯍꯤꯁꯇ꯭ꯔꯤ ꯈꯪꯖꯔꯒꯗꯤ ꯑꯩꯒꯤ ꯃꯦꯟꯁꯦ ꯈꯔ ꯉꯟꯅ ꯂꯥꯛꯈꯤꯑꯅ ꯈꯪꯉꯒꯗꯤ ꯗꯦꯟ ꯑꯩꯈꯣꯏꯒꯤ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯅ ꯊꯝꯖꯈꯤꯕ ꯑꯦꯋꯦꯔꯅꯦꯁ ꯑꯃꯁꯨꯡ ꯁ꯭ꯀ꯭ꯔꯤꯅꯤꯡꯒꯤ ꯃꯦꯊꯗ ꯃꯌꯥꯝꯁꯦ ꯃꯅꯨꯡꯗ ꯑꯃ ꯇꯧꯔꯒ ꯑꯩꯈꯣꯏ ꯕ꯭ꯔꯦꯁꯁꯤꯗ ꯀꯦꯟꯁꯔꯁ ꯑꯣꯏꯕ ꯑꯣꯔ ꯅꯨꯡꯉꯥꯏꯇꯕ ꯂꯤꯖꯟ ꯂꯩꯕ꯭ꯔꯥ ꯂꯩꯇꯕ꯭ꯔꯥ ꯍꯥꯏꯁꯦ ꯆꯦꯛ ꯇꯧꯊꯣꯛꯄ ꯐꯩꯌꯦꯅ ꯍꯥꯏꯖꯅꯤꯡꯏ
ꯁꯣꯝꯗ ꯑꯦꯡꯀꯔ ꯑꯣꯏꯅ ꯂꯩꯖꯕꯅꯤ ꯑꯩꯅ ꯗꯣꯛꯇꯔꯗ ꯍꯪꯖꯅꯤꯡꯕꯁꯦ ꯀ꯭ꯋꯦꯁꯟ ꯑꯅꯤꯅꯦ ꯑꯩꯈꯣꯏꯅ ꯂꯝꯞ ꯂꯩꯕꯁꯦ ꯋꯥꯟ ꯑꯣꯐ ꯗ ꯃꯦꯖꯔ ꯔꯤꯖꯟ ꯑꯣꯏ ꯍꯥꯏꯀꯣ ꯂꯝꯞꯁꯦ ꯀꯔꯤꯒꯨꯝꯕ ꯑꯍꯥꯟꯕ ꯍꯧꯔꯛꯄ ꯃꯇꯝꯗ ꯂꯧꯊꯣꯛꯈ꯭ꯔꯕ ꯑꯗꯣ ꯐ꯭ꯌꯨꯆꯔꯗ ꯑꯃꯨꯛ ꯍꯟꯅ ꯐꯣꯔꯝ ꯇꯧꯔꯛꯄ ꯌꯥꯕꯒꯤ ꯆꯥꯟꯁꯦꯁꯁꯦ ꯂꯩꯕ꯭ꯔꯥ ꯑꯗꯨꯃ ꯂꯩꯔꯦ ꯑꯗꯨꯒ ꯑꯉꯥꯡꯁꯦ ꯗꯦꯂꯤꯚꯔꯤ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯊꯥ 3ꯃꯨꯛ ꯄꯤꯔꯤꯌꯗꯁꯦ ꯂꯥꯛꯑꯣꯏꯗꯣꯏꯅꯦ ꯍꯥꯏꯌꯦꯕꯀꯣ ꯑꯗꯨꯒꯤ ꯃꯃꯥꯡꯗꯁꯨ ꯂꯥꯛꯁꯟꯕ ꯌꯥꯎꯋꯤꯗꯅꯀോ ꯈꯨꯗꯝ ꯑꯣꯏꯅ ꯍꯥꯏꯔꯕꯗ ꯃꯤꯑꯣꯏ ꯈꯔꯗ ꯊꯥ ꯑꯃꯒꯤ ꯃꯇꯨꯡ ꯅꯠꯇ꯭ꯔꯒ ꯊꯥ 2ꯒꯤ ꯃꯇꯨꯡꯗ ꯂꯥꯛꯄꯁꯨ ꯌꯥꯎꯋꯦꯕ ꯑꯗ ꯃꯈꯣꯏꯗꯅ ꯍꯦꯟꯅ ꯆꯥꯟꯁꯦꯁꯁꯦ ꯋꯥꯡꯉꯦ ꯍꯥꯏꯅ ꯂꯧꯒꯗ꯭ꯔꯥ ꯑꯗꯨꯒꯨꯝꯕ ꯂꯩ ꯇꯥꯔꯒꯗꯤ ꯑꯩꯈꯣꯏꯅ ꯑꯗꯨꯃꯥꯏꯅ ꯂꯥꯛꯈꯤꯕ ꯂꯩꯔꯦ ꯍꯥꯏꯕꯗꯨ ꯏꯁꯥꯅ ꯈꯪꯖꯔꯕꯅꯤना ꯀꯔꯤ ꯀꯔꯤ ꯄ꯭ꯔꯤꯀꯣꯁꯟ ꯂꯧꯕ ꯌꯥꯕꯒꯦ ꯍꯥꯏꯕꯗꯣ ꯃꯗꯨ ꯈꯪꯖꯅꯤꯡꯉꯤ
ꯀꯃꯟ ꯇꯔꯝꯅꯦ ꯑꯗꯨꯗ ꯑꯩꯈꯣꯏꯅ ꯂꯝꯁꯦ ꯉꯁꯥꯏ ꯑꯩꯅ ꯍꯥꯏꯖꯒꯦ ꯐꯥꯏꯕ꯭ꯔꯣꯏꯗꯤꯅꯣꯃꯥ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯀꯃꯟ ꯑꯣꯏꯕ ꯅꯨꯄꯤꯗ ꯅꯥꯕꯁꯦ ꯑꯩꯈꯣꯏꯒꯤ ꯕ꯭ꯔꯦꯁꯀꯤ ꯂꯝꯁꯦ ꯐꯥꯏꯕ꯭ꯔꯣꯏꯗꯤꯅꯣꯃꯥ ꯍꯥꯏꯁꯦ ꯃꯥꯁꯤ ꯕꯤꯅꯥꯏꯟꯅꯤ ꯃꯥꯗꯤ ꯀꯦꯟꯁꯔ ꯅꯠꯇꯦ ꯃꯣꯏꯁꯦ ꯋꯥꯟꯁ ꯂꯧꯊꯣꯛꯈ꯭ꯔꯒ ꯍꯜꯂꯛꯑꯔꯣꯏꯗ꯭ꯔꯥ ꯍꯥꯏꯕꯁꯤ ꯌꯥꯝꯅ ꯍꯜꯂꯛꯑꯔꯣꯏ ꯍꯥꯏꯕꯗꯤ ꯂꯧꯊꯣꯛꯈꯤꯕ ꯄꯣꯠꯇꯨꯗꯤ ꯍꯜꯂꯛꯑꯔꯣꯏ ꯑꯗꯨꯕꯨ ꯃꯥꯒꯤ ꯕ꯭ꯔꯦꯁꯀꯤ ꯑꯇꯣꯞꯄ ꯃꯐꯝꯗ ꯑꯃꯨꯛ ꯂꯥꯛꯄ ꯌꯥꯏ ꯃꯁꯤ ꯍꯣꯔꯃꯣꯅꯦꯜ ꯏꯁꯨꯅꯤ ꯃꯁꯤ ꯑꯗꯨꯅ ꯃꯥ ꯀꯦꯟꯁꯔ ꯅꯠꯇꯦ ꯑꯗꯨꯒ ꯀꯦꯟꯁꯔꯒꯤꯗꯤ ꯑꯃꯨꯛ ꯂꯧꯊꯣꯛꯈꯤꯕꯁꯤ ꯍꯜꯂꯛꯑꯔꯣꯏꯗ꯭ꯔꯥ ꯍꯥꯏꯕ ꯆꯞ ꯃꯥꯟꯅꯩ ꯉꯁꯥꯏꯒꯤ ꯀꯦꯟꯁꯔꯒꯤ ꯁ꯭ꯇꯦꯖꯁꯤꯒꯤ ꯃꯇꯨꯡ ꯏꯟꯅ ꯃꯥꯁꯤ ꯍꯜꯂꯛꯀꯅꯤ ꯍꯜꯂꯛꯑꯣꯏ ꯑꯣꯔ ꯍꯜꯂꯛꯑꯣꯏ ꯀꯩꯅꯣ ꯍꯥꯏꯕ ꯃꯇꯨꯡ ꯏꯟꯅ ꯑꯩꯈꯣꯏꯅ ꯃꯥꯁꯤ ꯈꯔ ꯇꯣꯏꯅ ꯁ꯭ꯀ꯭ꯔꯤꯟ ꯇꯧꯕꯒꯨꯝꯕ ꯆꯪꯉꯦꯀꯣ ꯑꯗꯨꯅ ꯉꯁꯥꯏ ꯍꯥꯏꯖꯈꯤꯕ ꯕ꯭ꯔꯦꯁ ꯂꯝ ꯈꯨꯗꯤꯡꯃꯛ ꯀꯦꯟꯁꯔ ꯅꯠꯇꯦ ꯑꯗꯨꯅ ꯂꯝ ꯈꯔꯗꯤ ꯍꯜꯂꯛꯄꯒꯤ ꯆꯥꯟꯁꯦꯁ ꯂꯩꯔꯤꯁꯤ ꯈ꯭ꯋꯥꯏꯗꯒꯤ ꯀꯃꯟ ꯑꯣꯏꯅ ꯍꯜꯂꯛꯏꯁꯤ ꯀꯦꯟꯁꯔꯁꯤꯅꯤ ꯑꯗꯨꯒ ꯐꯥꯏꯕ꯭ꯔꯣꯏꯗꯤꯅꯣꯃꯥꯁꯤ ꯅꯨꯄꯤ ꯅꯍꯥꯗ ꯆꯍꯤ 18-20 yearsꯗ ꯑꯩꯈꯣꯏꯅ ꯌꯥꯝ ꯇꯣꯏꯅ ꯊꯦꯡꯅꯩ ꯑꯃꯨꯛ ꯂꯧꯊꯣꯛꯈ꯭ꯔꯒ ꯑꯃꯨꯛ ꯍꯧꯔꯛꯄ ꯏꯚꯟ ꯃꯜꯇꯤꯄꯜ ꯑꯗꯨ ꯁꯤ ꯌꯥꯝꯅ ꯀꯤꯅꯤꯡꯉꯥꯏ ꯑꯣꯏꯕ ꯅꯠꯇꯦ ꯃꯌꯥꯝꯅ ꯁꯨꯝ ꯃꯥꯒꯤ ꯑꯦꯄ꯭ꯔꯦꯟꯁꯟ ꯑꯃ ꯂꯩꯕꯒꯤ ꯅꯥꯔꯛꯄꯗꯒꯤ ꯃꯥꯁꯤ ꯂꯧꯊꯣꯛꯅꯕ ꯉꯥꯛꯇꯅꯤ ꯑꯗꯨꯒ ꯌꯨꯖ꯭ꯋꯦꯂꯤ ꯃꯈꯣꯏꯁꯤ ꯔꯤꯒ꯭ꯔꯦꯁ ꯇꯧꯈꯤ ꯍꯟꯊꯒꯅꯤ ꯐꯒꯅꯤ ꯆꯍꯤ 40 ꯌꯧꯔꯛꯄꯗ ꯃꯣꯏꯁꯤ ꯑꯌꯥꯝꯕ ꯃꯇꯝꯗ ꯂꯣꯏꯅꯃꯛ ꯃꯥꯡꯉꯤ ꯕꯤꯀꯣꯁ ꯃꯥꯒꯤ ꯉꯁꯥꯏꯒꯤ ꯕ꯭ꯔꯦꯁꯀꯤ ꯗꯦꯕꯂꯞꯃꯦꯟꯁꯦ ꯍꯟꯊꯔꯛꯄꯗꯒꯤꯗꯤ ꯃꯥ ꯑꯗꯨꯝ ꯃꯥꯡꯉꯤꯅꯦꯕ ꯑꯗꯨꯗ ꯑꯩꯈꯣꯏꯅ ꯁꯥꯏꯖ ꯈꯔ ꯆꯥꯎꯕ ꯑꯗꯒꯤ ꯑꯦꯇꯤꯄꯤꯀꯦꯜ ꯅꯦꯆꯔ ꯈꯔ ꯂꯩꯕ ꯑꯗꯨꯒꯨꯝꯕ ꯑꯣꯏꯔꯒꯗꯤ ꯑꯣꯄꯔꯦꯁꯟ ꯇꯧꯕꯩ ꯋꯥꯅꯤ ꯑꯗꯨ ꯅꯠꯇ꯭ꯔꯒꯗꯤ ꯌꯨꯖ꯭ꯋꯦꯂꯤ ꯐꯥꯏꯕ꯭ꯔꯣꯏꯗꯤꯅꯣꯃꯥ ꯈꯨꯗꯤꯡꯃꯛ ꯑꯣꯄꯔꯦꯠ ꯇꯧꯕꯒꯤ ꯏꯟꯗꯤꯀꯦꯁꯟ ꯂꯩꯇꯦ ꯊꯥ 1ꯒꯨꯝꯕ 2ꯒꯨꯝꯕ ꯐꯤꯠ ꯇꯧꯔꯕ ꯃꯇꯨꯡꯗ ꯃꯥꯁꯦ ꯃꯦꯟꯁ ꯂꯥꯛꯁꯟꯈ꯭ꯔꯦ ꯍꯥꯏꯔꯦ ꯑꯗꯨ ꯍꯣꯏ ꯃꯦꯟꯁ ꯉꯟꯅ ꯂꯥꯛꯁꯟꯈ꯭ꯔꯒꯗꯤ ꯉꯁꯥꯏꯒꯤ ꯑꯩꯈꯣꯏꯅ ꯄ꯭ꯔꯣꯇꯦꯛꯇꯤꯞ ꯏꯟꯚꯥꯏꯔꯟꯃꯦꯟ ꯑꯃ ꯂꯩꯔꯝꯕꯗꯨ ꯌꯥꯝ ꯊꯨꯅ ꯃꯥꯡꯈ꯭ꯔꯦ ꯍꯥꯏꯕꯅꯤ ꯑꯗꯨꯅ ꯁꯤꯒꯨꯝꯕ ꯅꯨꯄꯤꯁꯤ ꯑꯩꯈꯣꯏꯅ ꯃꯥꯁꯦ ꯑꯣꯜꯋꯦꯁ ꯕ꯭ꯔꯦꯁ ꯀꯦꯟꯁꯔ ꯅꯥꯔꯅꯤ ꯍꯥꯏꯕ ꯅꯠꯇꯦ ꯕꯠ ꯃꯣꯏꯒꯤ ꯔꯤꯛꯁꯁꯤ ꯅꯣꯔꯃꯦꯜ ꯋꯨꯃꯦꯟ ꯑꯃꯗꯒꯤ खितंग मान रिक्स हेंगले अदुना मोय कोइना साइजबदनी मॉडरेट रिक्स कुमर चिंगानी अदुना कोइ जकोइना स्क्रीनिंग जिं खर नन होबा तारे स्क्रीनिंग मेथड खर तोंगान मा तोबा तारे सोमनगी कोइ नॉर्मल लो रिक्स वुमेन दगी मोकइना खितंग हायर रिक्स अदि हाई रिक्स तेना त मॉडरेट रिक्स कोइना दि हिस्ट्री म लैरना ब्रेस्ट फिट तौद्रे और मेंस गन लाक्सनरे सुबह मैम से रिस्पेक्ट लेबो मैम से कोइना स्क्रीनिंग से मतम जाना खरंगन न तोबसे ना प्रिवेंटिव एक्शन है हानि
आई मणिपुर द अयाम से कोई ब्रेस्ट कैंसर नाई से हम तुम कई नरग लोशन नरग थम मसुमा गदना आई जी लाइव लाइट यंग थोप लाई से अयाम मना स्टेज ngन लग लाप्रा नतग लास्ट स्टेज लाई से इन कसुम कोई न सोदम इंटरव्यू को ममे आमदम पब्लिसिटी होंजे ग्रम ने कोई ngasai happy to lam se कोई अयाम मना कोई अराबम फम सिंगल जबा नपी ना सिंग कोई खंगजदबनी ना पोमेन तोरगा माय गा ताना रा कांगा कोई मई सोन कॉटन तोर कोई एकदम इसिंग सांग तोर मेखाय बगे यावि सिदगी अमु हेन सोक्सिन गी बिसे मसी आइना खंगजनिंगी पोति मसी लाइव ट्रीटमेंट लाइव में से कोई लास्ट स्टेज त लाख ना त अर्ली स्टेज त लाख अनि से की कंपैरिजन हम तक है
मणिपुर से अर्ली स्टेज त लाखदी कम तांग थोए अदुबु last 1-2 years that we early breast cancer thing nabang may but news like awareness is kham posumali because of many factors social media print media na so khap to na pira na adubu more than 50% di apna technology locally advanced hai yam kana stage last na da maram se operate over ya da ba moji khana chemotherapy hana piba da ka leba sum se hana thing aduga yam late stage lai si oi ngai hangi question je yam na phasaba question ne noi atha padai la question ji yam thing kan lai operate over ya da ba saru da sandu ba lung sa sandu ba sum je koi toine thing atha padai gi sing je koi na toine thing aduna koi breast cancer awareness se koi matam bharagadi koi matam da atha pa sing ju koi yojana matum khona jai adu daki social koi issue le daki ju sapang jada bani aduna asagi print media ma sung koi press ki kana daki mediums daki ngasi program si koi manipur ki each and every corner yogi kani ha bagi thajaba le aduna kana na dum koi screen to ba ya bagi or detection to ya bagi kudang saw bang ne na lause
जरी बसे कोई वुमेन जर्नलिस्ट नातने तो हाँ ना सो कोई अनि टेस्ट की फैसिलिटी में हम ना कोई बगना क्लिनिक में 30% पीबी ना है ऑफर सिद्धि अमुया नहीं गलत ना बगी हम तो जो भी ना
I mean the amsha mali
seriously sumta le bagi nungai bun ta ni tom ta
already existing kind of the 30% or mal.
Yes.
So definitely condition to kra on doc se har the will definitely consider them to see. So already when a card holder we are going to come da AMJWU all members are card holders. So card to pull lagadi tum explain to na taga so taga even member na have the ID card mo lagsin to request. Aduna tum dire then nasigi awareness program say okay I important point as again the let us be conscious agni conscious level the lazy this day kitang henka kraga when over conscious orga the problem day nasigi session ji or over hunger ga dum breast cancer is khan ga di ding mada work ani normal life le mo medical term lazy say hypochondriac ko ye kana se disease am matang ek nei na ka dai se adu na du le na dum khan ba se so dum psychological or koi psychiatric problem adu na me chupai si na ra ne dum khan le se adu ko na hawai medical tamak matang da chapter by chapter le na se disease matang dum tam kan da every chapter khudingi medical students in the na du le ren khun le liver ye ta ga is liver normal le khan ये kidney discussion लागा ना kidney ना रहे तो मुखन बात माइट तब से तो ये hygienic मसीह awareness program से हमका नहीं let us be conscious about the disease but let us not make it over conscious अब मुखन ना लगे रखते हैं में हिम्मत मार अदुना पुन्ना मक्सिसु nature and almighty की देगी शोर की कनोने सिर्फ जो कोई accept तब से कोई prediction ना है जी भी contract होती इंडिया की mi contract hodingi mi mam cancer na ne hai mi tara ne thoi hundoi lady marta breast cancer ma lakani na predict hoina si prediction hai si statistics ne na matung ne hai to canada du nagada ge sin di sidi aidi sidi am tha ji lakshi ne amar ho na ka hai na se am khanjan na koi thoi war hoisi to bodo koi let us remain conscious about the disease. If we diagnose in time, we can prevent further complication. We can even cure from this disease. I was sitting seeing message in Pupiro. Aduga, atete me am meeting experts in Dhanabir. Loina, additionally, I think Mr. Manas can also make some announcement for the hospital.
Yes, sir, already.
Already done. Okay. Although, akoi punamak like Pabu is ever. Cancer hospital that Thumaro is ever. Let us not attain cancer hospital. Let us pray for that. Adu ki high hospital is thung si let us be all lucky people here together in this hall. Thank you very much.
Asigi breast cancer awareness man koi observe to kusida lingri ba AMJWU president koi mingona panjarbada Bijoy kakchingtabam koi Dr.Dabali, CMD of Babina, Manas Majumdar, Facility Director, AOI expert, Dr. Neha, Dr. Dhanabir amasung media gi lengbiriba chilina mayam aina ahanba tuda koramjari mayam ngasai je sum kenoda sarna ju jwa habiram do cancer ki utang sum khana je cancer na bo ja ning ne na ai ning na ba keno ma sum share ta ke ko mayam ta ahan boina koi hospital je sim just mayam ni keno tong na ba ai mathang da correlate to ke koi American Oncology with Babina Speciality Hospital koi facility medical oncology surgical oncology atopa radiation oncology amasung medicine ge surgery general surgery ge atopa specialty mayam ko punna to hospital han mayam la ko tam na sai when pinky ribbon ma the che hai kai no the is ha we are just a part of initiating the awareness program with the slogan pink together stronger forever ahan bagi photo ma ai mangasai ke de mayam je presentation service me to de mo pa go ina da medical terminology ne ahan bagi photo ai na mu chari ja aina American Oncology ahan ba joy to unamit ki sida thenggi ba patient gi photo ne aina la ba ka mo je nupa ji ga mai nupi ji ga staircase thamin na kap da yam thamo yam shocking oi ba keno ni ba aina iche kai daure na hange nupi je kitang ma je koi manipuri dialect se kitang wa le na nupa ji na hai ba sumaina ma no wai dire ba magi mobani se nasai saroina madam na takbiram ba thing na yum pan around 45 years ta moi mayum pan le adu ki matung da nupi je pregnant ku na sang oyu ya da da gi pregnant je oyu ba matung si da around tha hum buk so ba moi gi matam ji da ma je breast cancer na re se confirm oyu re moi doctor mayam tanar ba matung si da hai nang se chemotherapy pi da ya roi nang gi ngasai ge moi ngasai habi ba do lab na lai no pham si tanar la ko matam da su yang kuina chu dui matak ba ko gi finung gi ana bo oi ba hai ta ne aduna chung khangjan ba ge hina bi mu su lai ba aduna thing na lai ba adu matam da chemotherapy si pi kapsi ha ba matam ji da angang ji kai do re masai pregnant oi ba angang ji kai do ri ba aduna nupi ji na hai kapami je nupi ji na hai je ai ade hida kapsa roi ge adum ai icha je po ma gai si si ja ra ge hai ba mai nupa ji na hai ji na ai icha yau da zu ama yo je ga aduna ai nupi ji kal ji kemo kapsa awani je ba yam precious moment ne sida moi madumaina yamna aina ahamba thengna ba gi sum patient ni khoi si the patient consent de yaw khoi pulak lawza ba photo ni go si the utari sa adumai to kana mo je tha manga sa ba sai da operation to re to kya care oina law ro matung da chemotherapy ka po matung da angang je deliver to re tum khoi in contact le re angang je sahi amaga tha ni pan mu su re ba see the first time in Manipur da sune aduga India da su one of the cases ne si nupi ji rit ma je adum yam paduna doctor sing matam du am kan hona bi ko koi surgical oncology Dr. Dhanabir matam du ki medical oncology yam nupi mama ji ju kalore aduga macha ji su kaimuk to dana kai tijan kaijam dana dai do adu oi asi ahan cases ne moi khun gi mi na am la ga yam harau na na to ki ba doctor sing thagat ki ba case ahan na ani suba just here to tell you mayam je breast cancer na ya hai ta di cancer na ni je kitang thaidu ga tham gi chana du ma lai ga aduga mayam ra ta pul ju moi masana cancer na ja hai na emotionally moi masana khandana khanjari matang sida mo mayam na inthok pi inthok pa ko gi chana bi ma khal lai ba aina thamjai ba matang ji kai no ha to dang sa gi khena ba difference to yarin kai ko awareness na program ma oina saru ka mo ra khena ba je thamoi ji mo emotionally koi me ana mo je wa je financially ju physical ju emotional wo mentally ju
loina wajai ba aduna koina moje support to gibagi photo amane maje breast cancer patient ne moje koi mayamna koi ju society sida noigum ni hingni haibagi koina moje robert nauremna sinba patient show amada koina puthok jagiba patient ni ba mangoi mari manga nakanda le disease breast cancer na ba koina mayam uchari se kai gino haiba matamda na taraju ngasai koi je operation tawraga natraga chemotherapy kapal natraga radiation laying or matungda cancer ha base koi manage to bhai ai koi stagi koi hing bhai ai hai bado adu uchabani ko koi hospital je mayam je mut pinna legre ngasai gi sar gi to question yam hangam mane ai ngo to hang bira ko ya ni ko Manipur da koi cancer ki doctor jing je yam barang kai budi na te du koi gi na di da yam loi na suna radiation oncology da Dr. Tongcha, Dr. Danishwar Sharma, medical oncology da Dr. Sivasis, pediatric oncology da Dr. Sunamani, Dr. Dhanabir oncology, surgical oncology ne Dr. Danishwar Naurem, head and neck oncology, medicine da Madam Neha ga Dr. Taruni ga Dr. Maxon, amasung orthopedic da Sir Nongthon amasung Nabachandrana pediatric ko na lijawdi ko. Sida ay amatang mention ta ko wala ko nuclear medicine na ama wala ko. Nuclear medicine ay ko Manipur da susumay lay ka topic ka man nuclear medicine. Ay matang da slide to na last ke. Nuclear medicine Manipur da ko mayam na udik kahani cancer ni ka na chatla mapan ni cancer na te ka na sum haina bagi adum mayam sum chatla thing na ram ne ko. Tasing ni masih cum masu kara yawe dan masu kara yawe ko. Jadi koi sida ai uchari bu machine je PET scan machine go ho si je Manipur da koi American Oncology koi Babina Speciality Hospital si ga tang level neighboring states like Mizoram du late Nagaland du late ko Manipur du sin ga tane sida to je patient nama chemo ka pe na khala je ma je ka pa matung da phagali phagate ha bado si machine scan to ne if maze cancer je nare na de haiba only not for the breast cancer
The program is the chief guest on attention Biriba respected Dr. Bijoy Kakchingtabam, President AMJWU, President on election Biriba respected Dr. Dabali Singh, Chairman and Managing Director, Babina Groups of Company, guest of honor on election Biriba Mr. Manas Mazumdar, Facility Director,